Good afternoon and welcome to the Tuesday, March 15th, the year 2022 Insurance Subcommittee. You're in the House of Representatives and it is shortly after 1:30. Ms. Beatty, if you could please call the roll.
Representatives Subcommittee, Hicks, Kumar, Laverty, Mitchell, Rudder, Terry, Thompson, Chairman Hawk.
I'm here.
Mr. Chairman, you have a quorum.
Thank you very much, Ms. Beatty. Ladies and gentlemen, we are about to work on our week number 2 of our final calendar. I think we'll be able to get through most of these today, if not all of them today. That is our goal. Any personal orders for any committee members? I will take a moment of personal privilege. My 10-year-old daughter, Caitlin, is here, and to my left, to everybody's right, she has been diligently watching the work that we do, and she has lots of advice. If you need any help on your bills, she is ready, willing, and able to help anything. I pulled up my iPad just a moment ago, and she's got some notes left for me on my message board here of what I need to be working on personally, so I'm sure she'll help you as well. So if we could please make my daughter Caitlin welcome. Thank you. And we do have a calendar that we are going to work through today, if we're ready to begin. Item number 1 on our calendar, House Bill 2008 by Speaker Pro Tem Marsh. The request by Speaker Marsh has been to take that bill off notice. Without objection. Item number 2 on our calendars, House Bill 988 by Chairman Williams. Chairman Williams has just called and has requested that House Bill 988 be taken off notice. Without objection. We're now ready to address item number 3 on our calendars, House Bill 2048, House Bill 2048 by Vice Chairman Jernigan. You have a motion and a second. I believe we have an amendment that we're working on as well, Vice Chairman Jernigan. I think the amendment code that we're working on is 014158.
Chairman, yes, that's the amendment, and it does make the bill.
We have a motion and a second. I think we'll go ahead and get ourselves in proper posture. All those in favor of placing amendment coded 014158 on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. The amendment's on your bill. You're ready to describe your bill to us as amended, sir.
Thank you, Chairman. Members. Okay. This bill is limited in scope to complex rehab technology, which I will refer to later as CRT, so I don't have to say it over and over again, which in code is defined as high-end power and manual wheelchairs, very similar to the one that I'm sitting in now. And those chairs can run between $25,000 to $40,000. This bill does a couple of things. One, it prohibits a health insurer from considering the location where complex rehab technology, CRT, will be used when making a medical determination. And it also has a health insurer will pay 100% of benefits approved in a prior authorization by the health plan. The health insurer may not seek reimbursement based on inaccuracies found in their prior authorization. So basically, in a nutshell, what it does is if a health insurer issues a prior authorization saying we're going to pay 100% of this, then the vendor or the end user, such as myself, will not be responsible for any mistakes that the insurance company made. Typically, there's been cases where afterwards during audit or we should not have paid that, then we need $10,000 back. Well, that's your experts should have realized that on the front end. So those are is what the bill does. Like I said, it's very limited in scope, and I'm happy to answer any questions and further elaborate if I need to. Thank you.
Thank you, Chairman and members. Do we have any questions or comments for the representative, for the sponsor? Chairman Jernigan, I do realize, and you and I have had this conversation.
Yes.
I think there there was conversation about a potential untimely filed amendment, and I think there's just a very small clarification that we're going to be looking for, should you meet with a positive approval in this committee, that will work on a full committee that will include language that the Department of Commerce and Insurance has suggested that will say that this is not going to be considered any type of a mandate under the Affordable Care Act. Is that accurate, sir?
Yeah, that's correct. Commerce and Insurance came to me yesterday, about 45 minutes before amendments could be filed. But I agree with their assessment that they're making a clarification. It's not substantial at all. It just, under the Affordable Health Care Act, you can't have mandates. They just wanted the language to say this is not a mandate, and it's not. So.
Okay. And I'm comfortable, if the committee's comfortable, allowing the bill to go forward with the idea that we will have that revised amendment come full committee.
Thank you, Chairman.
Question has been called. All those in favor of sending House Bill 2048 to full insurance committee, please signify by saying aye. Aye. Any of those opposed, please say no. The ayes have it. Thank you very much, Darren.
Chairman, members, thank you.
Thank you. All right, committee and members, we are now ready for item number 4 on our calendar. Vice Chairman Baum. All right. Vice Chairman Baum, we have a motion and a second on your legislation. Sir, I believe we do have an amendment on your bill that is coded 015731. Is that accurate, sir?
I think I've got a different amendment. Could it be 14704? No, I think you're right. 015371. 731.
All right. We have a motion on amendment number 1 that is coded 015731. We'll go ahead and get the bill in the posture and then allow you to describe after that, if it's all right, sir. All those, we did have a motion on the amendment. Do I hear a second? We have a second. Thank you very much. All those in favor of placing that amendment code on House Bill 2625, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Now, sir, I think we're in the proper posture now, and as that is the latest amendment that we've been discussing, and I'll let you go from there, sir.
Thank you, Chairman Hawk. In Tennessee, we have a certain population of citizens who are eligible for both Medicare and Medicaid. We might call them dual eligibles. They currently have 6 different options with which to receive both types of benefits, Medicare and Medicaid, or Medicare and TennCare. One of these 6 options allows these individuals to have what's called a DSNP plan. It stands for Dual Eligibles Special Needs Plan with a Medicare Advantage carrier. Now, under federal law, this carrier must have a contract with the state, must have a contract with TennCare. TennCare currently has a number of these contracts, but TennCare is proposing a change. It's proposing to only renew contracts with 3 MCOs, which means that only those 3 MCOs would have the necessary contract to participate as a DSNP Medicare Advantage carrier. This could impact Tennesseans. It could impact those DSNP dual eligibles who are currently on a plan that isn't one of these 3 MCOs. Because this might impact these Tennesseans and their coverage, this bill would require the state or TennCare to study the impact of its action in terms of how it would impact these individuals and their health care. It would study the notice that TennCare would give to these individuals so that they would, to ensure that they're aware of this change if it were to be approved. And this all falls within the legislature's purview because we have oversight of this plan, oversight of changes like this. So this is a bill that in its first part would require this kind of a study to assess impacts. There's a second part of the bill that would require TennCare to have no MCO with more than 25% of this population. If any MCO has more than 25% of its population, then we'd have to add more MCOs. This is designed to give these dual eligible participants more choice. And I'm happy to answer any questions you have.
All right, thank you very much for that explanation. All right, do we have any questions or comments for our sponsor? Let me, and thank you, Chairman Speaker, for withdrawing. I appreciate that. Let me ask one question, and you may not have got deep into this particular amendment, Chairman Baum. I know we've just introduced it, and we've just trying to decipher it ourselves. We were talking about earlier dual enrollees, but could this potentially affect all TennCare enrollees? Is that something that, and I'm just looking at Section 2 of the bill, which is on page 1, that there's a potential that this, the delineation of 1/4, 1/4, 1/4, 1/4 actually could affect all TennCare enrollees. Is that something that it's on your radar screen there, sir?
I cannot tell you the number of TennCare enrollees that this would impact, but I can give you some numbers for some context. There are about 1.7 million Tennesseans on TennCare. The population that's dual eligible for TennCare and Medicare is more in the range of 20,000. So we're talking about a population of individuals who are eligible for both Medicare and Medicaid, and that's a very small fraction of the total TennCare population. Again, about 20,000 versus 1.7 million folks on TennCare.
All righty, thank you very much, sir. And sometimes it takes my hand a little while to catch up to my mind as I'm writing notes on that. Thank you very much. And I think there's a timing mechanism that's in there as well that says TennCare may have to accomplish this RFP in a 30-day window, and we may look at in a different time frame as well. I think much like the bill that we just passed a moment ago, the chair feels comfortable if the committee feels comfortable moving this bill on to full, with the idea we've got a couple of areas that we're going to need to have broad discussion about and address not only the limitations in the number of enrollees, but also the potential time frame that we're looking at to potentially enact something like this. So I think we do have a framework of a nice bill that seems to be supported by several folks, but does need a little bit of work that since this is going to be our last meeting, that I do feel comfortable passing it on to full committee. Any questions or comments of any members? Dr. Kumar, Chairman Kumar, you're recognized.
Thank you, Chairman Baum. Certainly, I think something needs to be done along the lines, but as we move to full committee, I'd like you to think about the objections that are from TennCare. What is their difficulty with it? I'm sure you've given it some thought. And also, 25% seems arbitrary, but at the same time, that would mean there will be 4 instead of 3 MCOs in TennCare. Well, yeah, I think that maybe it's reasonable in the sense that we don't want to crowd it with a number of MCOs either. Yeah, but those are my thoughts. I think we need to consider what the difficulties for TennCare are. I think they were concerned about the time constraints and so on. So kindly give it some thought, and we'll talk about it more in full committee. Thank you, Mr. Chairman.
Thank you, Chairman Kumar. Any further questions or comments? Are you ready to vote? All right, all those in favor of sending House Bill 2625 to full insurance committee, please signify by saying aye. Aye. Any opposed, please say no. No. If you'd like to be recorded as no, please let the clerk know. Your bill passes. Your bill moves forward. House Bill 2625 moves forward to full insurance committee.
Thank you all.
Thank you. All right, we are now ready for item number 5 on our calendars. House Bill 2456. Representative Sparks. Chairman Spicky, I'm sorry. All right, if Representative Sparks is listening, I will roll his bill to the heel of the calendar today, and otherwise, what action may occur on other bills if members are not present to present, the chair has the latitude to take those bills off notice if they do not arrive to have those bills discussed. So, without objection, House Bill 2456 is rolled to the heel of today's calendar. We are now on item number 6 on our calendar, House Bill 1973 by Leader Camper. Leader Camper, you are recognized. We have a motion.
Thank you, Mr. Chairman and
Did
committee.
I hear a second? We have a second. You are recognized, Leader Camper.
Thank you, Mr. Chairman, committee. Members, last week I was here presenting this bill on behalf of Senator Lamar, and it is the bill that creates a pilot program within TennCare for remote patient monitoring. And the posture we were in, I was trying to adopt an amendment, and TennCare had some input that they wanted to give, which we met with them, and we have the amended language to satisfy TennCare. We changed it from we made it medically necessary. So if a doctor deems that it's medically necessary, then they would in fact allow the remote monitoring.
Okay.
Problem is, I don't think we met the deadline on the filing deadline.
Lady Camper, do you have the code on that particular amendment for us?
I do.
Yes, ma'am. If you could
It
tell me.
is 015796.
Okay. Ladies and gentlemen, that would be an amendment that would make the bill. It has been untimely filed. I'm at the will of the committee as to your desire to consider this particular amendment. We have a motion and a second to consider the amendment. All those in favor of consideration of amendment drafting code 015796, please signify by saying aye. Any opposed, please say no. All right. We are considering your amendment, and you gave us a brief description. Is that ultimately what the amendment would do, Lady Camper?
Yes, sir. And thank you, members, for agreeing to help me with this untimely amendment. I really appreciate it. But yes, that's all that's changing. We're making it medically necessary versus what we had before, which was medically appropriate, I think was the language. And we changed it to medically necessary.
Gotcha. Okay. All right. We're in the posture to adopt amendment number 1. Yes. Do I hear a motion and a second to adopt the amendment? We have a motion. We have a second. All those in favor of adoption of amendment, once again, drafting code 015796, please signify by saying aye. Any opposed, please say no. The ayes have it. Your amendment is adopted, Lady Camper.
Okay, thank you, members, for adopting an amendment. This bill would give us an opportunity to help mothers that's having a problem with pregnancy, whether it's due to some health concerns, health risks like diabetes, preeclampsia. This will give them an opportunity to be monitored. So if something happens, the monitor kicks in, they can go and get medical help, and I think this will help us save a lot of babies in the state of Tennessee.
All right. Thank you. Any questions or comments for the sponsor of the legislation? I will make just a few comments. Again, I tend to put my finance committee hat on whenever I come into this committee, and I know several folks serve as yourself as well, serve on the finance committee. And as we're still working on the fiscal note, I think that policy-wise, I think we all see exactly where you're coming from. Financially, we'll have to see how this fits into the budget document, but certainly thank you for bringing the idea forward.
Oh, thank you, Mr. Chair. I was just going to thank you for that. I think once we get the new fiscal note to go with this, we will see that the numbers will drop. The numbers will drop. And what I also don't think is reflected in the fiscal note is if we can preclude mothers from having to have these emergency C-sections, that will save us money. And I don't think that's really been factored in, but it might be as the bill moves forward with fiscal as I'm trying to work through it. Thank you, Mr. Chairman.
Thank you. Chairman Terry, did you want to be recognized?
Thank you. I was just asking about the fiscal note and what this may do, the fiscal note, and you addressed it. Thank you.
Thank you.
Thank you.
All right. Chairman Lafferty, you're recognized.
Thank you, Mr. Chairman. It sounds like this is putting a requirement. Right now, does TennCare, if a person is, say, a high-risk pregnancy, are there already provisions in place for TennCare to offer those moms some help?
I think it does, but what the monitoring would do would better help to notify so that if the mother is in a situation and don't realize it's happening, by the time they get there, it's an emergency situation. So what this pilot would do would give TennCare the opportunity to have these women to be monitored. So as soon as they see that something's going wrong, then they can get the help, and they don't end up in the emergency room. That's kind of been the problem, and it's costing TennCare more, actually, if they are serviced in the emergency room versus going to a doctor when they see the onset of a problem. Mm-hmm. That's what we're trying to preclude.
All right, thank you.
Thank you.
Thank you. Are you ready to vote? All those in favor of sending House Bill 1973 as amended to full insurance committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Mr. Chairman, committee.
Thank you, Leader Camper. We are now ready for item number 7 on our calendars, House Bill 2109 by Leader Love. Leader Love.
Thank you, Mr. Chairman.
We'll wait for a motion and a second on your bill. We have a motion. We have a second. You are recognized, sir.
And I believe there may be an amendment.
Yes, sir. We've got, and this is a situation, ladies and gentlemen, another untimely filed amendment that we will potentially need to consider. Drafted code, sir, that I've got 2 different ones. Tell me which one you're looking for.
I believe it's 015894.
Okay, 015894. Okay. I've got a fiscal note on 015662. Hang on just a moment.
And the updated, I think, fiscal is non-significant on. So I prefer to use the one that doesn't have a fiscal note.
I understand. That makes sense. As described to me, Leader Love, the amendment code number that you signified, 015894, is the one that we would like to move forward with.
Yes, sir. Yes,
that may be the most beneficial to you, sir. We do have, it is untimely filed, so the chair is in a posture to. Motion to consider. We have a motion to consider the amendment. We have a second. All those in favor of consideration of amendment number 1, please signify by saying aye. Aye. Any opposed, please say no. We will move forward with consideration of your amendment. If you could give us a brief description, sir, of where we are and what the amendment's going to do to the legislation, please, sir.
Thank you, Mr. Chairman. And the amendment makes the bill. The amendment deals with doulas. Doulas are non-medical professionals who provide emotional and physical assistance in different aspects of reproductive health and provide emotional support to mothers when they're in the process of childbirth. And so this particular amendment would have the Department of Health to collaborate with the Bureau of TennCare to study existing doula certification programs. And this collaboration would review the training and quality requirements of doula certifications and consider potential recommendations regarding doula services for populations most at risk for poor prenatal outcomes. And the report is due by December 31st, 2022.
You have heard the explanation of the amendment. We have a motion to adopt the amendment. We have a second. Before we take a vote, just to get some clarity, and I believe I heard that this is a study by TennCare to look into that. We're not looking to create an automatic certification of doulas. This is a study to work on the process, correct?
That's correct. And let me also give credit to now Senator Lamar, who was the sponsor of this legislation. And we've been in a long process getting to this place. Actually, this weekend, had a good conversation with both the Senate sponsor, Senator Massey, and people from Health and Free Tennessee and from Department of Health, collaborating to try to figure out what's the best language to try to get to this place.
Thank you. We have a motion and a second on amendment coded 015894. All those in favor of placing the amendment on the bill, please signify by saying aye. Any of those opposed, please say no. The ayes have it. Amendment is on your bill. I think you've done a very good job of describing it. Any questions or comments for our sponsor? We're on the bill. Yes, Dr. Kumar. Chairman Dr. Kumar, you're recognized.
Thank you, Mr. Chairman. Thank you for bringing this, Leader Love. Just as an observation, doulas are basically coaches or life coaches through pregnancy and postpartum and early childhood. Especially for young women, first pregnancy, these are very, very useful resources. Used to be that grandmothers and mothers took care of this function. But as the fabric of our society is not that tight anymore, this becomes a necessity. But I think it becomes a necessity, and it will be good to have it. That's how I read it, and thank you for doing it. Thank you, Mr. Chairman.
Thank you, Chairman Kumar. Any closing comments, Leader Love?
No, sir. Just thank the committee, and again, thank all those who worked to get us to this place.
All right. Committee, are you ready to vote? All those in favor of sending House Bill 2109 as amended to full insurance committee, please signify by saying aye.
Aye.
Any of those opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Mr. Chairman and committee members.
Thank you very much. All right. We are going to go a bit out of order. I took a chairman's prerogative and I rolled item number 5 on our calendars, Representative Sparks' bill, House Bill 2456. I took prerogative to move that bill to the heel. I'm going to reconsider that, and without objection from the committee, seeing none, we will go to item number 5 on the calendar, House Bill 2456. Representative Sparks, you are recognized.
Thank you, Chairman.
We have a second.
Thank you.
Forgive me, my hearing must not be very good today. We have a motion and a second on the bill. Representative Sparks, do you have an amendment? Is that
There is it, let me see, drafting code, is it 013284?
That is correct. We have a motion and a second on amendment number 1. Let's go ahead and put the amendment on the bill, ladies and gentlemen, and then we'll hear the explanation when we get there. All those in favor of placing amendment code 013284 on the bill, please signify by saying aye. Any of those opposed, please say no. The ayes have it. The amendment is on your bill. Please describe your bill for us as amended.
Well, it's a reference-based pricing bill. I don't know if members remember, we had a summer study about, I believe it was 2 years ago. It's a complicated issue. It really is. Former Representative Martin Daniel had latched on to this and really started digging deep. And if y'all remember Martin, he's kind of a pit bull when it comes to cost and tackling issues. He couldn't be here to testify today. He can be up here. He thought he could be up here next week, but I thought is this your last calendar? Okay. And so we want to get it. It's simply asking for TASSER to take this up on studying the reference-based pricing. Montana took this up and went with this with their employee health care plan, saved $13.6 million. And I know Montana's not a great comparison of a state. They're much, much smaller than us, but they did have some significant savings. North Carolina also looked at this and has attested saved some money as well. When we started looking at the health care plan, there was a lot of discrepancies there. Ralph Weber, who's wrote several books on health care and improving transparency, has really dug into this, and what he's saying, we could save anywhere from $70 to $90 million if we shifted to a reference-based pricing. So that's all I'm asking for is a simple study, and to just improve. I think it would improve transparency. I think it would help us to just dig down on our healthcare cost. I can go into much detail on this if you need me to, on some of the outliers that they had found on some of the cost that Ralph's company had found. For example,
Thank you, Chairman Sparks. I think we're good.
all right. I mean, I can go into some details, but that's what I'm asking for is a study.
Thank you. Any questions or comments? Question has been called. All those in favor of sending House Bill 2456 to full insurance committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward,
Thank
sir.
you, Chairman. Thank you, committee.
Thank you. All right. We are moving. All right, ladies and gentlemen, we are now moving to item number 8 on our calendar. All right, ladies and gentlemen, item number 8 on our calendar, House Bill 2233, at the request of the sponsor, is being taken off notice without objection. All right, House Bill 2233 off notice. All right. We are now on to item number 9 on our calendar, House Bill 2879. Vice Chair Rudder, you are recognized. We have a motion and a second. I think we've got an amendment on this as well, Lady Rudder, that is coded 014776. We have a motion. We have a second. Let's go ahead and get it in the proper posture. We'll put the amendment on. All those in favor of adding amendment code 014776 to the bill, please signify by saying aye. Any of those opposed, please say no. The ayes have it. Lady Rudder, please explain your bill as amended.
Thank you, Mr. Chairman and committee. This bill has to do with our copay accumulator bill that we passed out of this committee last year. And what I'm still working with both sides on this, and so I would like to move this on to full committee so I can continue to have those discussions. And with that, I ask your indulgence and let me move this on to full committee. This bill, we may not need to continue those discussions, but I would like to have that opportunity.
Thank you, Chair Lady Rudder. And I think there's some votes going on in the Senate right now at least the meeting is beginning in the Senate right now that could have some bearing on this. But much as Chairman Kumar has allowed us to move some bills from this subcommittee to full with the idea of seeing what may happen in the Senate or working on amendments, again, the chair feels comfortable in doing so. Any questions or comments of the sponsor of the legislation? All right. Question has been called. We are on the bill. All those in favor of sending House Bill 2879 to full insurance committee, please signify by saying aye. Any opposed, please say no. If you'd like to vote no, please let the clerk know. The bill passes. House Bill 2879 goes to full committee. Let's give it to Dr. Kumar. I'm actually going to take it off notice. We're on item number 10, Doc.
Okay. We are considering item number 10, House Bill 002 by Chairman Hawk. Chairman Hawk, you're recognized.
Thank you very much, Chairman, and I appreciate you taking the gavel. House Bill number 2 is a bill that we've been discussing for a couple of years now, and it's essentially a surprise billing, a balanced billing piece of legislation that we've discussed. The Senate passed a particular piece of legislation on this that enacted that. Oh,
We have a motion and a second. Please continue.
thank you. I appreciate that. That essentially codifies what has just recently been passed by federal law. We're in a wait-and-see mode on this particular piece of legislation. I think there's many factors that are swirling about now. With that being said, my desire today is to take House Bill 2 off notice.
Well, without objection? I don't see any objection to it, so House Bill 002 is off notice.
Thank you. Thank you, Chairman Kumar, very much. All right, we are moving on now to item number 11 on our calendars. House Bill 2351, and we have received a call from Vice Chairman Hall's office that he would like to have this bill taken off notice. Without objection, House Bill 2351 is off notice.
Closing music.
Thank you, Mr. Chairman, for all the hard work.
It's time to pay compliments to everybody, the members for their hard work, the staff, and all that. Do you have closing music?
No, it's a special calendar.
All right, ladies and gentlemen, before we move forward, I do want to take a little privilege from the chair. I want to thank everyone for the diligent work that you have provided this subcommittee this year. We may or may not get called back in, depending on what the situation is. I thank you for your attendance. Thank you for your diligence. You've done some tremendous work, and I appreciate you more than you ever know. Chairman Subcommittee, you are recognized. Motion to adjourn. We are adjourned.
To the call of the chair?
What's that?